So I have chosen to talk to you about two of these problems, the first two, namely the OR block optimization and length of stay, and briefly about the overall optimization. So this is a graph in which you see there are some opportunities for scheduling elective procedures. The horizontal axis in this graph indicates the day of the week, and the vertical axis indicates the number of patients that are in the hospital at 11:59 just before midnight. The reason hospitals, what's called the census of the hospital. The reason I'm looking at that is because somebody who is in the hospital at 11:59 in a bed, most likely, almost certainly, will spend the night in the hospital. So as a result, what you see in this graph is typical in many hospitals in the country. This particular is from Hartford Hospital. You see that there is a peak for that census on Thursday, followed closely by Wednesday. But in other days of the week, Tuesday, Friday, Monday, and so forth, it goes down significantly. So the key idea is to utilize optimization, namely select when a particular surgeon operates, whether it operates Mondays or Wednesdays or Tuesdays or Thursdays, and reshuffle these times in order to decrease that peak. The implication of decreasing that peak is that you now have more available beds to allocate. Because if you have reached the capacity of the hospital on Thursday, let's say the capacity is 200, and you occupy it, you don't have the capacity to admit more patients because you have reached the peak capacity of the hospital. In addition, you have scheduled, when the hospital schedules the resources, it has scheduled appropriate resources to cope with that peak. So the objective of OR block optimization, to summarize, is to decide which days of the week each surgeon should operate in order to reduce congestion in floor bed availability. In order to demonstrate the effect of block allocation, I would like to utilize an example. So hospitals arrange for blocks of the surgeons. So typically, a particular surgeon, for example, Dr. Smith, it operates on Mondays in the operating room number 1, and on average, he completes this every Monday, 2 complete cases. These are more complex cases, and the patients that undergo this surgery stay in the hospital 4 days. And in addition, on Thursdays, he operates in the same room, but these patients leave the hospital the same day without staying in the hospital. So if you look in this graph at the census of the hospital, just by Dr. Smith, you see that on Monday, because the surgery on the complex cases started Monday, Tuesday, Wednesday, and Thursday, the census increased to 2. The other days, it is 0. On the other hand, if you switch, if instead of operating on Mondays, he operates on Thursdays, then as you see in the graph, contribution to the census starts on Thursdays, Fridays, Saturdays, and Sundays, and then Mondays, Tuesdays, and Wednesdays, the contribution is 0. In other words, by just a very simple flip, we see that the contribution to the census has been affected fairly significantly. So imagine trying to do that for the entirety of all the surgeons in the hospital. Not all of them, but more than one, of course. To give you just an example, the current schedule for all hospitals is represented by blocks. Each block includes the surgeons, the service, for example, neurosurgery, general surgery, gynecology, and so forth, and the day of the week. For example, a particular doctor on Tuesdays does robotic surgery. Another doctor on Fridays does GYN oncology. And finally, another doctor on Mondays does plastics. Each hospital has a current schedule. So the question is now, how do we optimize it? So this is what I'm about to describe is an optimization algorithm that allocates blocks to surgeons, patients post-surgery or in preparation for that. So not every day of the week surgeons operate, but they typically operate in a particular pattern, a particular block. So this is what I'm about to describe is a strategic problem of allocating the blocks in a way that optimizes capacity.